Hi, Dr. Milky, back with another message about plantar fasciitis. I actually have a foot here that I can show you some things on. I put 4 marks on the foot because these are the 4 areas that typically people have pain in. So we're going to start with the most common spot for plantar fasciitis is right here. It's this X right here. It's called the medial band of the plantar fascia, and a large percentage of people have pain right there when I press on their foot. Another spot that's real common is in the center of the heel, right here where this X is. So right in the middle of the heel, and you might be experiencing this kind of pain where you're walking and you're feeling like you're stepping on a nail, or there's like a deep ache to that spot. But there's 2 other spots in the heel that aren't on the bottom that are more on the side. So this one here is right over, there's a muscle right here, so we call it the muscle belly, and there's a nerve underneath there. So you can have plantar fasciitis type of pain, and yet that spot right there, that nerve gets real sore. You may not feel it, but when the doctor presses on it, it might be really uncomfortable. And then there's another spot back here, there's another nerve right there that, again, you might not feel it when you're walking, but if it gets pressed on, it's sore. So you might want to just press on your foot and see if you have pain where these 2 X's are, because they're not the most common places where people would think of plantar fasciitis. If these 2 are involved, it's a little bit more difficult because there's a nerve involved. And the longer you've had symptoms, the higher the chance that the nerve can get involved. It may start down here and then eventually end up over here. So 4 main places for plantar fasciitis. You could have 1, 2, 3, or all 4. If you have all 4, just going to take longer to get better. So that's my message today about plantar fasciitis.